First, live, local. This is Fox 12 Now.
All right, well, welcome everybody. I'm Fox 12 meteorologist Katie Zuniga, and today you are watching one of our special weather editions of Fox 12 Now, and we are specifically talking about allergy season. And we asked for topics that you folks wanted to go through in a little more in-depth in these special weather segments, and this was at the top of the list because we have quite a few allergy sufferers out there. Recently, I sat down with Dr. Peck. She's a pediatrician at Kaiser Permanente, and she went through all of the different allergy symptoms, things that we're feeling right now, things that we're dealing with, gave some great ideas and topics that we work through to try and help you alleviate some of those allergies and make it through the season, because right now both grass and pollen allergies are up to moderate. So let's go ahead, jump in and hear what advice she had to say. You could let us know, what are some of the most common allergy symptoms you're seeing in children right now with these warmer temperatures that we are having here in the Portland metro and the Valley areas?
Definitely. Allergy symptoms consist of red, watery, itchy eyes, sneezing, stuffy nose, scratchy palate, coughing, and sometimes hives.
What are some early interventions that are, and why is it so important when it comes to managing allergies this season? For, you're a pediatrician, but maybe you can speak to both adults and kids.
Allergy symptoms are misery making. It's really uncomfortable. It's hard to be outside, especially when weather is so beautiful. So breathing, really important.
What are some of the maybe early intervention things that you can do to try and mitigate that from, being a bother when you go outside?
During this season, knowing that symptoms are quite seasonal and that can be predictable, starting allergy medicines ahead. And that can include things like over-the-counter, non-sedating antihistamines, things like Claritin and Zyrtec. Taking those medications at their effective dose, and particularly in the morning, can be a real help.
How can parents distinguish between, and as a parent, I'm actually very interested in this question when I thought of it, between seasonal allergies and something lingering like a cold or a virus? Or even not even just kids, like even adults.
The difference between allergies and infection is presence or absence of fever. Allergies are typically not accompanied by fever, but some of the symptoms can be quite similar. So if you're using those medications effectively and not noticing a difference, or if things seem to be taking a turn for the worst, more severity of symptoms, difficulty breathing, flares of asthma symptoms, that's when I would have a patient come into the office and be checked by a physician.
When should a person or a parent seek medical attention? When it's, even if it is, allergies, is there a point in which they should even go in then and it's not a virus or something worse?
Allergy symptoms can be severe for some people, and when they involve swelling of your face, your eyes, lips, tongue, or airway, that's really when I would say higher level of care and in-person consultation can be really needed.
What are some at-home things, that we can do other than, is there anything other than medicine that we can do to either mitigate or help the allergies? I'm thinking specifically, like I've heard people talk about air filters or cracks in the doors or washing your clothes. Like, what are some things like that that could help you out?
On days where the pollen counts are higher, staying indoors and keeping windows closed, having that air filtration system can be really beneficial. And on days where you're able to go out, then thinking about protective clothing, that can include eyewear, sunglasses, hats. When you're done out of doors and coming back inside, washing off your face or rinsing your nasal passage with a saline solution can be very helpful, and sometimes even taking a shower.
And I just had this thought, like when we go to the mountain, we go skiing, or when we go to the beach and we want to go, somewhere where it's warm, we prepare our clothing and our attire for that. So, when you're going to the mountain, you have your ski pants and your goggles and your mittens, and you go to the coast, you typically take shorts or a bathing suit and towel. Is there any type of clothing that's better to wear that's maybe like a less likely to attract things that could, that's not as, like spores that won't stick in it? Is there any type of clothing types that are better during allergy season?
Not that I'm aware of, although post-pandemic, some people will actually wear their mask as a means to block pollens from binding in their airway. So if that's something you're comfortable with, especially on those higher pollen count days. Or I'm thinking about bicyclists or persons who have like wind coming at their face. Then perhaps goggles, glasses, or face protection could be something to consider.
Are there any differences in how allergies present themselves in kids versus adults? And is it common for kids to eventually outgrow it?
Yeah, I spoke with one of our Kaiser allergists, and he said it's really hard to predict who might be at risk for allergies and who might outgrow them. Although there does seem to be some family history, so sometimes having that information about your family members can be helpful. For kids, they tend to take several years to be sensitized to allergens. So typically environmental allergens we won't notice in children until after about the third birthday.
Okay.
Previous to this, I don't often think about cough or nasal secretions as being due to allergens.
I always heard that you can, like, I don't have any environmental allergies right now, but they can develop. Is that kind of the same thing?
Absolutely, absolutely. And what can happen as well is different areas have different pollens. Just from the climate and ecosystem. So you may not have had allergens perhaps in a different location, and in traveling and living in Oregon, find that suddenly you seem to be allergic. So absolutely, these are things that can develop over time and feel new, even for adults.
For families where both children and adults are experiencing seasonal allergies, are there shared strategies that work well across the ages with them?
Over-the-counter medications are available for both children and adults as long as you follow package dosing instructions. Those are medicines that can be used for each.
I'm going to assume in that too as well, like we talked about, the things that you said, washing your hands, your feet, your face, changing your clothes, bathing your children or yourself when you come in, all of that obviously works for both ages as well.
Correct. And, one preventative strategy I sometimes think about is if you're aware of a particular allergen that you have, for example, if it's grass, then not directly exposing yourself in terms of like not putting your face in the grass. If you're having a picnic, put a blanket down. If your child has a severe grass allergy, maybe they don't mow the lawn. Some of those are, strategies, and knowing what you're allergic to can help you get a better sense of what activities are best for you and what should be avoided.
What's one piece of advice that you would give to parents who are just starting to navigate seasonal allergies with their children for the first time?
When you're first learning to do something, there can be some hits and misses. One common thing that I notice is not being consistent with medicines. You really can't get that benefit if you're not taking the medicines as directed at an effective dose and consistently. So I would say that is the most important, keeping that as part of your routine. And, kids are really smart and they're good at taking care of themselves. So they can incorporate taking their medicines as part of their daily plan.
Is there anything specifically that that I didn't think to ask you, or that, advice or things to be aware of, or anything that you can add that I wasn't able to come up with when I was thinking about my questions for you?
Oh, that's a good question. I do have something. I was thinking, allergens for people can manifest differently. And for example, some people have more severe eye allergies, very much with like redness, discharge. There are over-the-counter allergy drops that can manage these symptoms, as well as for nasal symptoms. If over-the-counter medications aren't effectively treating nasal symptoms, you can add things like Flonase or other nasal sprays. And one other thing I thought of is that an allergist could help determine what allergies a person is most sensitive to. And perhaps in knowing this can make immunotherapy. Those are allergy shots to decrease responsiveness over time. It's really hard in Oregon to avoid grasses. Feels like if you're allergic to grasses, it's really hard to go outside. So sometimes for people who have more severity of symptoms or have those common allergens, then talking to an allergist about a program for themselves is a really helpful kind of strategy.
Now I was hoping you could either myth bust or help me settle kind of something as I've talked about this before. So like I said, I don't have seasonal allergies. I'm very thankful, knock on wood, they won't develop. But I'm
Yes.
curious, you know, when we're going through, because we do allergy reports and, you know, we do allergy forecasts and stuff like that, you know, as we go through allergy season to try and help, you know, inform and prepare people. When I'm looking at rain that's coming in, I've had people tell me, oh, I hope it rains so it can knock all this down. And then I've had other people tell me all that does is put it on the ground and where I can breathe it in more, and it makes it harder for me. So like, where is there truth in that, or is it going to be different for different people who have different sensitivities? Is there anything, any information or wisdom you can give me on that?
Definitely, rain can physically take pollens down to a ground level or reduce them from the air. However, if heat accompanies rain, if after a rain shower you get heat or wind, then those pollens could be kicked back up. So I think when we get that Oregon spring weather with sun breaks and raindrops, hopefully we're getting, you know, the benefit of less pollens. But maybe not.
So when we get in that, basically the pattern that we've been in, we were warm for a few days and then we're going to get a few showers tonight, and then we're warm for a few days and then we're going to get more showers, you know, coming up in the weekend, then that definitely is kind of almost doesn't help people when it goes through, because it just can be kicked up or moved around a little easier.
Yeah, it's probably a good practice to say that with irregular weather, the pollen count can be variable. And unless the rain is consistent, probably counting on the benefit of that effect, probably not there.
I'm just curious. I've always heard people say that Willamette Valley is known as the Valley of Death because of the allergies. Is that true to you, or is that false, or do you know?
I have not heard that, but in speaking with one of our allergists in preparation, he did say that we had one of the worst grass allergens in the past couple of years. So I do think if you're allergic to grass, it is hard to go outside. And people will tell me when I ask, what are you allergic to? They say, I'm allergic to Oregon. I am allergic to being outside. And I'm like, I don't know how you could live here, because I love the out of doors.
Yeah.
And I don't want to pace my life around what's happening outside when it's beautiful. You know,
Yeah.
one of your questions was like, are there certain times of days to avoid? And I'm like, who could do that? You know, when you have to go outside, then you need to be outside. So especially with kids or your work schedule, it's like, how am I going to advise people to, you know, not do those activities?
I want to thank Dr. Peck again for joining me and talking through all of the different things and allergies to be watching out for. Maybe you heard something or learned something new. I hope that helped you with alleviating it for you, or maybe someone you know. And if you have any ideas that you would like me to go into our Fox 12 Now weather segments, make sure and email them to us. We have an email for you. You can send it to the fox12now@kptv.com, and I'll do my best to try and get those interviews and those topics covered for you here on Fox 12 Now. Thanks so much. Have a great day.